Pandemic may be over, but that doesn't mean COVID cases have gone away.
You may be one of the many who have fallen victim to the virus recently, some for the second or third time.
Couple that with flu season in a couple of months and talk of vaccines for RSV, and it can become overwhelming.
Tonight, our Natasha A is going in depth on this, speaking with a doctor about what you need to know so you don't get vaccine and virus fatigue.
It's uncomfortable and annoying to be sick.
Anyone who has fallen victim to a virus can attest to this statement. Now more than ever, as COVID cases are back on the rise. For 3.5 years, Natasha Pierre has escaped contracting COVID. That is, until July 13th. Almost 3 weeks later, and she is still testing positive.
I've tested at least 10 times, and every single one has been positive.
Dr. Fernando Bularudas with Johns Hopkins All Children's Hospital says she may be an anomaly. Those who can't seem to rid the virus, he says, often have pre-existing conditions. Natasha had asthma as a kid and pneumonia 2 years ago.
We're still learning from this virus. There's a lot that we're learning, and so far we haven't been able to pinpoint a predictability on saying this is when we're going to start seeing peaks.
That said, Dr. Bularudas says the virus does seem to creep back up in the summer months, perhaps due to summer getaways, as well as the winter season. Think holiday travel and family gatherings. The CDC shows the current uptick. From June 16th to July 15th, 7,100 people were hospitalized.
We have to be cautious about all of these viruses circulating.
Those other viruses Dr. Bularuda is referring to are the flu and RSV. All three of these viruses having the potential to wreak havoc on the respiratory system and seem to be joining the party all at the same time. Now, there's an RSV vaccine for the elderly, and while it is FDA approved, it's not available just yet. The same goes for the antibody protection for kids under the age of 2. That begs the question, is all of this vaccine and virus talk giving us fatigue?
There could be fatigue, but I would just say, let's trust our scientists, let's trust our institutions, our healthcare workers, and there are new recommendations to get vaccines this year.
If you are going to be in a tight space, Dr. Bularuda recommends masking up. It may be inconvenient, but so is getting sick. Vanessa Ariza, ABC Action News.
Vanessa, thank you. If you haven't received a COVID booster in the past 6 to 12 months, Dr. Bularuda suggests getting one now. The same goes for a flu shot this season. As for the RSV vaccine, he says those who don't fall in the 60-plus age range should be okay skipping that vaccine. Of course, with all of this, it's really best to consult your doctor first.